What's up guys, Dr. Aaron McNally here with Revival Performance Physical Therapy, and today I'm going to be showing you guys a simple exercise to help you learn how to control your core and the motion of your pelvis and your hips. So these are called bent knee fallouts. So in this position you're going to be on your back with your knees bent, and you're just slowly going to be letting your knee fall out to one side while you're controlling the pressure of your back on the mat. So you're not letting anything move except for your hip and the lower extremity, and you're not letting the low back move. So that's gonna help you learn how to control that pelvis as you're moving. So laying on your back just like this, knees bent, and tightening that core so where your back is kind of squished down against the mat here. A weird way of thinking about this is thinking about kind of holding in your pee. It's called a Kegel exercise. That's gonna tighten some of the right muscles in your pelvic floor and in your abdominal muscles to maintain some of that tension in your low back and that stability there. So keeping those tight, and then very slowly letting this one knee fall out to the side as far as you feel like you can, but most of your effort is going into not allowing this to happen. So notice my pelvis is staying in one position. Here's the other side, just like this, and the only thing moving is my leg and at the hip. So I'm not allowing any movement to happen like this. So you can put your fingers on those two little bumps on the front side of your hips, and as you let this one side go out like this, if it starts to come up against your finger on this left side, then you know it moved at the pelvis. So see there, I moved at the pelvis. Here, I stay nice and level here, and nothing's happening at the pelvis, it's only happening at the leg. So do the prescribed amount, just very slow and controlled. If you're just moving all over the place like this and that back's rotating all over and your core's not engaged, it's not doing you a whole lot of good. Yeah, maybe it's loosening up your back or your hips, but that's not the point of the exercise. The point of the exercise is to control that pelvis and control that motion at your hips. So have fun.